Persistent pain syndromes can be incredibly frustrating to deal with. In this episode, we'll talk about how exercise can be used as a self-management strategy to help overcome persistent pain syndromes. Persistent musculoskeletal pain is a little bit of a mystery. Sometimes there's an injury that kind of starts everything off. Maybe we were deadlifting or squatting, and as we were going through the movement, we felt a pop in the lower back, or maybe just had a really intense episode of low back pain, but then the pain never quite resolves after that initial injury. But what's a little bit more common is that there's no injury actually to kind of start everything off, and that the pain just kind of gradually increases, and then it just lingers for a long period of time without a specific cause or specific injury that led to the pain. And so generally when this happens is that as the pain lingers, a lot of times we'll think, well, maybe there's a structural cause of the pain. Nothing quite healed properly, and that's why I'm getting the pain. So we'll get imaging, x-rays, CTs, MRIs, looking for that specific cause of pain. And through that journey, we'll see medical doctors, orthopedic surgeons, chiropractors, physical therapists, occupational therapists. And while we're going through that journey, that patient is looking for someone to fix or find out what is going on, that specific diagnosis and a specific cure on to fix whatever is going on. The problem is that these structural changes that we see on X-ray or MRI aren't closely correlated with pain. And so while the patient is actively seeking to find some sort of structural problem so that they can fix it and therefore resolve their persistent pain, there's nothing actually to fix because the structure is okay. And so the big problem here is that there's inherent patient dependency because they're constantly looking for someone else to fix them. And so in musculoskeletal medicine right now, there's a transition from passive therapies done to the patient, to active therapies where the patient is empowered to actually control and manage their pain syndromes. Passive therapies are therapies done to patients, and so generally this would include spinal manipulation, soft tissue therapies such as active release technique, Graston, or massage, or electrical modalities, cold laser, motor nerve stim, and ultrasound. And all of these can still be used in a treatment program. The way that we typically try to use them is that if a patient is scared of a certain movement or there's just too much pain, we can use those to kind of help the patient overcome that barrier. But we want to make sure that the focus isn't just on those passive therapies and that we're actively trying to get them into active therapy so they're moving on their own and they're not reliant on those therapies. A viewpoint published in JOSPT by Nathan Hudding looked at how we can integrate self-management treatment strategies into our treatment plans for those with persistent pain. And they came up with a 3-step process that we can use. The first step is to identify the patient's barriers and goals. And as part of this, I think it's important that we ask the patient, well, why do they think they're in pain? Whether it's a structural cause, a psychological cause, what do they think is causing this pain? Because it can help us navigate what is going on. If they think it's a structural cause, we can kind of help them overcome that barrier. But if we don't actually ask them, we don't know what that barrier is that is holding them back. We just kind of assume. The second step is identifying strategies that we can use to help either reduce the pain or avoid symptom exacerbation. And with this, I think it's important to note that sometimes it's okay to have pain and that we can push into it a little bit. It'll depend on the patient. Sometimes they're a little bit too fearful, and so they need to kind of move into pain a little bit to kind of overcome the barrier. This is always going to be patient dependent because there's also some that need to kind of tailor it back because they're pushing too far into pain. And then the third step is providing support during this process. And I think this point is absolutely vital because a lot of times with self-management strategies, people come in and then doctors just tell them, oh, you need to do this, 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 and this. And then there's not much follow-up. But we need to have that follow-up because there needs to be that team mentality to make sure that they're able to implement these strategies and we can make changes and suggestions as we go along, because like as I was saying before, pain can be a pretty scary experience, especially when it's persistent. And so having someone there to help navigate this process can help ensure a more effective strategy. In clinical practice, exercise is commonly used, and we generally use it to help strengthen a body area. So if we look at the use for low back pain, we're strengthening the core muscles to improve stability. Or if we're looking at impingement syndrome or rotator cuff syndromes in the shoulder, then we're strengthening the rotator cuff again for stability. And while strengthening the body area is one benefit of using exercise, we can also use it as a self-management strategy as well. So for someone who's had persistent pain in a given area for a long period of time, they commonly get to a point where they'll just accept that that's just the way it is. My shoulder's always going to be painful, or my low back's always going to be painful when I bend forward. But we can use exercise as a way to kind of give them a roadmap to show them that their body can actually change, and that doesn't necessarily always have to be painful. So let's look at the shoulder, for example. Let's say that there's always pain with overhead movements. Well, we could take an exercise band and maybe we'll pull it apart and then have the patient go up overhead and then back. And let's say that helps to decrease the pain, and that shows the patient a couple different things. One, it shows the patient that the pain's not always permanent. With persistent pain issues, they think that every time they're going to go up overhead, there's going to be pain. And so if we could just modify either the muscle activation strategy or the movement pattern, and that helps to decrease the pain, well then we know that the pain's not permanent. And with that, it also shows the patient that there's a little bit of a roadmap. If we can replicate whatever we're doing when we're pulling the band apart, whether it's activating more muscles or we're just changing that movement pattern, that's what we need to do, and that will kind of lead us to a more permanent solution to conquer this persistent pain issue. Thank you for watching this episode on self-management strategies for persistent musculoskeletal pain syndromes. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up. And if you want to see more of my content, go ahead and hit that subscribe button as well. If you want to be notified of future posts, hit the bell icon as well. I'll see you guys in the next video.